Hi, I'm really excited about talking about care of patients, especially at home in their own surroundings. This is something I have grown up during my training in the UK, where everything was community led once the surgery was done. Finally, we have that here in India, and Max is really rolling it out for us. And the advantages of this are manifold. One, the patient is in his own home surroundings with the home sounds, smells, food, and especially the family members. In addition, the rehabilitation of the physiotherapy. As I'm an orthopedic surgeon, patients with joint replacements need rehabilitation and physiotherapy. So being offered at home gives the flexibility and the advantage of being able to pace it to one's own speed, I would say. And the second advantage is, once you are at home, the risk of coming to a hospital, of not only the time taken, it's also preventing infections, especially in the times of COVID. So services at home have a big plus to them, and that's the way forward in the near future.